Welcome back to WKRG News 5 at 5. January is Cervical Cancer Awareness Month. Joining us tonight for this week's Medical Moment is Dr. Jennifer Scalisi, the Chief of Gynecologic Oncology at USA Health Mitchell Cancer Center.
Doctor, thank you for being here. We're hearing about the Cancer Institute's campaign. Can you tell us more about it?
Sure. It's called the Go Teal and White campaign, and it's celebrated all during the month of January for Cervix Cancer Awareness Month. And the goal of this campaign is to raise awareness about the HPV vaccination. It is cancer prevention. And also, given the COVID pandemic has disrupted life in many ways, we want to encourage women to get back into screening and do routine health care maintenance. And part of that is routine pap smears and HPV testing.
Dr. Scalisi, you talked about vaccines being cancer prevention. Let's talk about exactly what is recommended as far as the vaccine. You're talking about vaccinating children.
Absolutely. The HPV vaccine is recommended between ages 9 and 12 ideally, but it's also recommended up to age 26. And based on risk factors, it also is recommended up to age 45. The ideal time to vaccinate is somewhere between age 9 and 12 because most adults have been exposed to the HPV virus. And if we are able to vaccinate before exposure, we are able to maximize cancer prevention. So in addition to cervical cancer, HPV is the cause of 6 other cancers in men and women and is responsible for about 99 out of 100 cases of cervical cancer. So vaccination is indeed cancer prevention from a cervical cancer standpoint.
And are you seeing more parents choosing to vaccinate their children, or are you still seeing some hesitation? There's some baggage with this issue for some people.
Absolutely. We're seeing it increase in uptake, and we actually have seen not only an increase in uptake, we're also beginning to see a decrease in cancer incidence, which is huge. The HPV vaccine was rolled out in 2006, and over the last several years, only recently are we starting now to see a reduction both in pre-cancer and in cancer with use of the HPV vaccine. And based on that data, we've certainly seen an increase in uptake in the HPV vaccine because we have a cancer prevention vaccine. And I think that's the point of the Teal and White campaign, is to make people aware this is truly a cancer prevention vaccine.
Absolutely. Dr. Jennifer Scalisi with USA Health, thanks so much for educating us tonight.
Absolutely. Thanks for having me.